orgulho muito grande poder receber a professora Felton aqui conosco. É uma outra pessoa que mundialmente importante na educação em diabetes. Ela tem viajado pelo mundo inteiro, multiplicando esse conhecimento da educação em diabetes pelos vários países em que frequentou. E agora nos dá a honra de poder contar com a sua presença aqui para compartilhar conosco os seus conhecimentos nessa área tão importante do tratamento de diabetes, que até algum tempo atrás era considerado era um banquinho de 3 pernas, agora é um banquinho de 4 pernas. Era a educação, quer dizer, alimentar, quer dizer, alimentação, atividade física, medicação, que podia ser injetável ou não, insulina ou droga oral, e de uns anos para cá, a educação passou a ser o 4º pilar do tratamento de diabetes.
Nem sempre foi, enfim, reconhecido pelas autoridades. Eu queria mencionar que sem a equipe nada disso teria sido feito. Pegando no pé da nossa chefe de enfermagem para, enfim, nós trocarmos ideias com a enfermagem. Nós temos uma enfermagem pioneira nesse processo de educação. A doutora Cláudia Piper acrescentando alguma coisa a mais no nosso processo educativo. Internacional, a vice-presidente da International Diabetes Federation, a professora Felton.
To be recognized as a global threat to mankind. And then we have World Diabetes Day, and I think that's about it. One quotation which is from Chekhov, who was a medical doctor, and he did say, a doctor is called, but a nurse is sent for. I certainly think that nurses here in this country, in this vast country, have much to contribute in relation to diabetes care, education and research and policy development. And you have an excellent example here in Ulma. Thank you so much for your patience. And if you have any questions, I'm very happy to hear it.
It's such an important contribution, not just within your local community for people with diabetes and their families, but also through your research and publication, how that influences the rest of the global community. I want to pay particular tribute to my nursing colleague, Uma, because what she demonstrated here this morning is not just the role of the nurse as an educator, but also as a researcher, and in establishing a research protocol, carrying it through the statistical analysis and the way in which that actually changes the provision of care in this innovative way. This is actually unique. I do not know, and I know quite a bit about what happens in the world in relation to pediatric diabetes, of anybody who has actually done this. And you have already demonstrated through your research, doing a Medline research with regard to publication. So please make sure that this is published, because it is hugely important. Now, I have, first of all, may I also thank Professor Ricardo, I'm not good at names, I'm getting old, Claudia, and Rosa, I think we said yesterday, for their hospitality, friendship. You actually represent 2 organizations in a sense, as the Vice President of the International Diabetes Federation. And my responsibility as a volunteer in that is global political advocacy. And as President of the Foundation of European Nurses, I have something of a different role. So I'll try and bring those 2 things together. But I really would like you to instruct me of the role of the nurse, the diabetes specialist nurse, and I want to emphasize that in Europe, how it has evolved over the last 25 to 30 years, and specifically the influences that have brought that evolution about, and how it's continuing to evolve. When I was appointed as a diabetes specialist nurse in 1980, this is in the United Kingdom, there were just 4 of us. And in a sense it was wonderful, because nobody quite knew what we would do.
but nonetheless we were appointed. We were competent in the sense that we worked in the area of diabetes, and particularly in metabolic medicine, within hospital, within inpatient services, but not in the context of people managing their condition themselves. So generally what we did, we were receiving the emergencies and managing the emergencies, but not looking at people in the context with this chronic disease, who from time immemorial, whether we like it or not, and whether they did it well or not, were always the managers of their condition. So it's taken us a very long time to actually understand that, and that we as professionals have an important role to play in ensuring that people with this chronic condition can actually be enabled to self-manage it on a daily basis in a better way than they had done in the past. But in order to do that, we ourselves as professionals have to be competent in terms of clinical science, research, practice, and obviously the nature of and the trajectory of diabetes in order to be able to teach people to self-manage their condition, and indeed their families where that is appropriate. I would also say that not just nurses as nurse specialists in diabetes, but that all of you, whether you are clinicians, endocrinologists, or whatever, we also have an additional role there's another part to education, in my view, you may disagree with me of course, is that we have a responsibility to the general public in relation to this epidemic, and to bring that awareness to them, because there are things that is possible to do to at least delay the onset of type 2 diabetes. But also we have a responsibility to influence the policies at a political level and at a geopolitical level. So it isn't just enough to consider blood glucose monitoring day to day and hemoglobin A1C and the management of dyslipidemia, hypertension, renal function, screening for the complications, particularly in relation to macrovascular disease. We have to bring that to the political decision makers in order to ensure that the service that is provided and made available, whether that is in the public service or in the private service, that actually these facilities and accessibility and sustainability, and I've heard this word here several times this morning from the key presenters, sustainability is hugely important. So all of you, and I know that Johannes Kessel from Novartis, he has listened to some of my presentations from time to time, and he said I'm becoming much more political, the organization. And I think you can read that, but you have the handout, so I'm not going to waste time going through that, but if you want to ask me about it later, that's fine. The other aspect is, and I mentioned already, why is it that we need to be involved both from a multidisciplinary and an interdisciplinary perspective? It's the sheer size of the problem. Now, these statistics that I'm presenting to you now are out of date, and I know Eduardo gave me a very interesting definition of a bikini last night, and I hope I've got it right, but it said it exposes everything but the essentials. And to some extent, that is a criticism of the way in which we present data. But it is recognized both from the World Health Organization perspective and most recently from the United Nations and the UN Declaration for Diabetes in 2006, that diabetes is a major global public health problem. There is no denying premature mortality. This is a huge economic loss as well as a social and family loss to any nation. But also, what I think we have been able to do is to bring together some other pan-European organizations that from Primary Care Diabetes Europe, and we have perhaps not mentioned the role of primary care in diabetes care, particularly type 2 diabetes and in the prevention of diabetes. And in Europe, there is a pan-European organization of primary care physicians, that's family physicians, family nurse practitioners, and dietitians who work at that coalface. And each of these organizations, together with the International Diabetes Federation, the European region, and you have your own region here, to some extent, develop and support the destiny which we choose as professionals. So it is not unusual in Europe to have, within the nation states, within the culture and profession of nursing, to have specialization. So, for example, we have cardiology nurses, we have nurses, oncology nurses, we have nurses who are midwives, we have nurses specializing in pediatrics, and then specializing even further in pediatric diabetes, for example, and we've had some there. So those sort of legal structures are already established. Diabetes specialist nursing is relatively new in our history, and certainly probably only came to real acceptance, and it was a struggle to have this acceptance recognized probably in the mid to late 80s. So it'll give you some idea. Now, reference was already made to Leonie Miller here in the United States, and the work that she had done in relation to education. But we also had in the United Kingdom, of course I have to show the UK flag here, Dr. Joan Watkins from Leicestershire, which is in the Midlands in the United Kingdom. And she established, through her charisma and powers of persuasion, the role of the visiting diabetes nurse for children with diabetes in the late 40s, early 50s. And this became a very well-established role. And she also developed with her pediatric nurse colleagues the training program to extend the competency and knowledge of pediatric nurses and diabetes. But it took much longer to establish the clinical role of the diabetes nurse in the United Kingdom and indeed in other parts of Europe. And the resistance was much more difficult to understand and overcome than the resistance we find in type 2 diabetes, believe me. Do you understand what I'm saying? It was really, really difficult. And that resistance to change or to development was much more identified within our own professional hierarchy. We are a very conservative group in a way, and being radical is extremely dangerous in any country, but being radical as a nurse is absolutely almost, well, I won't say. But anyway, we have come through, and it is recognized not just in daily practice, but as a matter of registration, in legal registration, so that positions that are advertised in diabetes centers for a diabetes specialist nurse, they have to meet certain criteria. They must undergo a degree of training in the specialty, but also that needs to be ongoing as well. And in the same way as we have in the practice of medicine, every 5 years, everybody who is licensed to practice, be he or she a nurse, a doctor, or a dietitian, must have that license to practice renewed through a process of assessment and examination. And this is entirely proper because we must be competent in relation to those people whom we serve, i.e. people with diabetes. So there are very, very stringent regulations in some of the countries in Europe, not in all. The further south we go, perhaps the more relaxed it may be. But I won't point out any country so that I don't embarrass. It's quite radical, it can be quite difficult, but also we have to be sure that patients will accept this change. So it's not just the change for ourselves and the legal and professional responsibilities that that brings, but it is also the way in which the public will receive that service and relate to, and not feel that because my consultation is with a specialist nurse or a specialist dietitian, they are less important. Do you understand what I mean? And also for some of our medical colleagues, that too was a challenge and still is in some quarters, that their responsibilities, their legal responsibilities, and that their professional training or professional status may be downgraded. So these are hugely important issues as we develop our services, and looking at the demand of those services and indeed the costs. The other areas that we have to be very, very careful about is that governments, particularly health ministries, where health is a huge element in any budget, in any national budget, that they might say, well, why don't we train nurses to do all of this? They're cheaper. That's not the point. And we must be very wary of these discussions. And because actually, unless we engage with people who make these decisions, whether it's the World Trade Organization or whatever, we are, in a sense, going to be neglectful of our responsibilities. Now, I'm not saying that you approach every clinic with all of this in your head. This is impossible. But it is part of your responsibility, whether you are a nurse or a doctor engaged in this, to become much more active in your civic responsibility in relation to health and quality of life. As nurses working in the specialty of diabetes, responsibility in terms of identifying and screening at-risk populations in relation to type 2 diabetes, and ensuring that there is a sustained infrastructure that will countermand those risks. We also have a responsibility to ensure that we are competent to deliver this. So there is another dimension to our professional obligations, and therefore that means a dimension with regard to training and education in primary prevention and in dealing with those whom we identify who are at risk. Whether it is that within our own communities, certain ethnic minorities, as you will know in the United Kingdom, we have a huge sub-Indian population who are highly at risk in relation to particularly type 2 diabetes. We also have a responsibility in relation to other at-risk groups, particularly the management of pregnancy and diabetes, the planning of pregnancy for those women in their reproductive years who have diabetes, and also for those who develop diabetes in pregnancy, gestational diabetes. And in ensuring that there is absolute joint collaboration and joined-up planning for the management of this particular service to these people. How do I know this? I know this because of the audits that have been carried out in relation to pregnancy outcome and pregnancy outcome and diabetes and gestational diabetes. We thought, this is in the United Kingdom, that we had quite good outcomes. Was just to light up the buildings. And when Professor Ricardo spoke this morning, I'm so sorry, I should have worn a blue dress. I'm totally inappropriate. But I promise, next time I come, I'll be dressed in blue. But this is the London Eye. Have many of you been to London? You have, right. Well, this was established for the millennium, the year 2000. And it is quite a landmark feature on the south bank of the Thames, where all of our important theatres are, particularly the Festival Hall, the National Film Theatre. It's a rather wonderful site. So we do have some culture in London, believe me. And this is lit in blue for the whole of the week of the 14th of November. And behind it is the Shell building, which is another rather large building. And we have running sort of commentary in relation to diabetes globally and, of course, in our own little country. And it does attract very considerable attention. generally speaking, we invite the Secretary of State for Health, the representatives of the Diabetes UK, which is the national patient organisation, and key people who contribute in such a positive way in relation to diabetes care in the United Kingdom. Now, H.G. Wells, was, I should say, a founder of Diabetes UK. Quite sort of, it had negative connotations. So we changed ourselves to be Diabetes UK, United Kingdom. H.G. Wells was a scientist, basic science. He was also a man of letters, and you may have read some of his work, but he had diabetes. And when they established, he and a doctor who had diabetes from King's College Hospital in London, when they established Diabetes UK, this is what they said: human history becomes, or what H.G. Wells said, human history becomes more and more a race between education and catastrophe. I think that applies in all our walks of life. Whether we are working in the service of, in the health service, and particularly in this chronic disease, but whatever other areas, whether we're lawyers, clergy people, teachers, whatever. If ignorance kills, and education offers the possibility of a better life, provided non-communicable disease to be recognised as a global threat to mankind. And then we have World Diabetes Day, one quotation which is from Chekhov, who was a medical doctor, and he did say, a doctor is called but a nurse is sent for. I certainly think that nurses here in this country, in this vast country, have much to contribute in relation to diabetes care, education and research and policy development. And you have an excellent example here in Ulma. Thank you so much for your patience. And if you have any questions, I'm very happy